Greetings, my name is Jae Kim and I'm a researcher at the Korean National Rehabilitation Research Institute. In today's presentation, I'm hoping to share a study on the usability evaluation for deriving directions for improvement of the digital healthcare system based on the health and safety net for people with disabilities. In this presentation, people with disabilities will be defined as PWDs. I have divided my presentation into 5 sections. Challenges posed by the COVID-19 pandemic situation, notably to PWDs, include incidence and deterioration of health problems, exposure to lifestyle-related disease and restriction on healthcare utilization and information acquisition, which necessitate a wide range of support with regard to health utilization, mental health, transportation, and personal care. To efficiently address these problems, it is necessary to establish and implement a health and safety net designed to ensure that health, safety, quality of life, and daily living of PWDs. There is a growing awareness about the importance of building a health and safety net based on digital healthcare systems such as ICT-based local community online services and patient monitoring technology. In Korea, as part of a health information platform construction project, mobile health management services are widely provided to local residents and senior citizens. However, no government-led online healthcare project exists for PWDs. We have developed an app-based online health information sharing system involving major stakeholders, PWDs, caregivers, and healthcare professionals as groundwork for constructing a health and safety net to support the health management of PWDs and their caregivers and to enable rapid response in a crisis situation. In this study, with the participation of public health and welfare professionals, a usability evaluation was performed on the digital healthcare system developed for the construction of a health and safety net for PWDs, with the aim of deriving the directions for system improvement in order for them to be used as basic data for system enhancement in the future. Let's move on to the next. For three health and welfare professionals related to PWDs were randomly selected based on convenience sampling, and a questionnaire survey was conducted for usability evaluation of the newly developed digital healthcare system based on the health and safety net for PWDs. The questionnaire included explanations about the main features of the digital healthcare system based on the health and safety net for PWDs, system architecture, and user interface. A 15-item questionnaire consisting of the 10-item system usability scale and 5 items for user satisfaction and an open-ended expert questionnaire. The main feature of the digital healthcare system based on the health and safety net profitabilities are: 1. Providing customized health management contents profitabilities. 2. Encouraging the health life of PWDs and their caregivers by sharing information on health and health life on PWDs, caregivers, and healthcare professionals. 3. Providing information on health, safety, and welfare. And 4. Identifying health and safety needs at any given time. The system consists of 6 categories in UI. The 6 categories of the digital healthcare system are: 1. My Health at a glance, 2. My Profile, 3. My Health, 4. My Wellbeing Assistant, 5. Health Together, and 6. Communities. The subcategories are outlined in Tab 2. Figure 3 illustrates the UIs developed for user participation based on the system architecture in Tab 2. Source is questionnaire that can be used for evaluating the usability of various products and services. Each item was rated on a 5-point Likert scale. Of the 10 assessment items, odd number items were positive questions, where higher score indicated a superior system, and even number items were negative questions, where a lower score indicated a superior system. Table 3 outlines the source assessment item and contents. User satisfaction was evaluated using 5 assessment items on overall system satisfaction, architecture, and understandability, degree of interest, recommendation, and continuous use intention. Each item was rated on a 5-point Likert scale as in the source item. Let's move on to the next. For usability evaluation, 43 physical disability related welfare professionals participated in the study. Their sociodemographic characteristics were analyzed as follows. The gender distribution was 38, means 88.4%. The most frequent age group was the 40s, followed by 30s. Occupation distribution showed 26 academics, 9 healthcare professionals, and 8 industrial practitioners. The most frequent career length was 10 to 19 years. The overall source mean score was 62.4. Items with lower values than the overall mean source score were identified as complexity, convenience, simplicity, professionalism, and learnability. Source scores are divided into the rating categories of best, imaginable, excellent, good, fair, poor, and worst imaginable, and a source score lower than 69 indicated problems requiring investigation or solution. In this study, the overall mean score was 62.4, which correspond to source grade D, objective rating fair, and acceptance level of nearly acceptable. The overall satisfaction mean score was 71.2, with the items overall satisfaction, architecture and understandability, and continuous use intention marking lower scores than the overall means value. Let's move on the next. The findings highlight the need to improve with a simpler system. Simplicity was found to be positively associated with the continuous use of information system from utility aspect, and ease of use was identified as a determinant factor for utility and attitude of use, which was positively associated with continuous use intention. A successfully upgraded app can be an effective healthcare service model for comprehensive health management of not only PWDs but also their caregivers. In addition, it would be a highly significant system solution to integrate the tripartite sharing-based digital healthcare system into the envisaged local communication health management project system for PWDs, in that it can become a high usability integrated health and welfare service model for PWDs. The study analyzed the comprehensive improvement direction for system architecture improvement, centering on complexity, simplicity, professionalism, learnability, and convenience, with the aim of enhancing the usability of a newly developed digital healthcare system. It is necessary to put continuous efforts into improving system satisfaction and continuous use intention by deriving concrete system improvement needs and addressing them through system enhancement. It is expected that such research outcomes will contribute to developing an effective healthcare management service model that addresses all problems facing PWDs and their caregivers. This is the end of my presentation, and thank you. If you have any questions, please contact me by email.